Okay, welcome. I hope you're all well. All right, the thalamic modulation that we coined last time, uh, thalamic modulation therapy. We're going to coin this. It's going to become big, even if it's big with one person. It's it's big, right? Just even asking yourself, right? Not only saying hi to your thalamus occasionally, midline structure. I mean, the cool part about it, it's all anatomy. Um, okay, okay. Can you see that? That blue thing that you see? Those are your ventricles filled with cerebrospinal fluid. Okay, so if you go to any of my YouTube and look at the cerebrospinal fluid, all right, those are the ventricles that are filled with cerebrospinal fluid. All right, talk about an intimate relationship with the fluids in your brain. So the third ventricle there this midline fluid structure here. One of those, it separates, and going through the third ventricle is that intrathalamic junction that they still, the function of that is not clear, to be honest with you, but it pierces. It's like an island in the middle of the third ventricle. The hypothalamus is also part of the diencephalon, bilateral, right in the middle, with the third ventricle dissecting it, essentially being that perfect midline structure in the middle of the thalamus. Okay. It's the major relay hub for all sensory input to the higher cortex, right? So if we can do something to the thalamus to shift what it's sending, then the higher order brain structures they're gonna get a different signal, right? So again, as mindfulness meditation, calling it thalamic modulation therapy, and knowing exactly that we are affecting the way that the thalamus is processing information by practicing mindfulness. We have the data. When you look at it anatomically, you go, wow, that is so cool. At least I do. And you start to see, where it is in the brain. You start to have a relationship with it. You start to say hello to it. Now maybe you can be like, hello, thalamus, right? And it's not like back here. It's like right in the middle, literally, like if you were going to draw a line from like your nasum, the start of your nose to your back, straight about midline, made up of multiple nuclei, sending sensory information up to your cortex, as well as other things. So you've got to imagine how important the function of the thalamus is. Number one, thalamic strokes are totally detrimental, but learning how to modulate the thalamus appropriately and consciously through the practice of meditation can be very powerful as well. So, although we do joke a little bit, not joking at all in terms of, hey, I'm actually, when I do mindfulness meditation, we are actively shifting the neuronal circuits in the brain in real time. Right. And how is it helping with pain? Well, in a multitude of different ways. Not only one way. Right? How does mindfulness help with pain? Not only one way. But we know that it's actually decreasing the signals from the thalamus to the other areas of the brain that process the sensory input. And so again, the reason you use lidocaine when you go to the dentist is you're blocking you're blocking the nerve sending the signal. If you block the nerve sending the signal, you don't get sensory information going to your brain. If the signal gets to the thalamus but blocks it, but it blocks at the thalamus, it's not going to get to your brain. It's not going to get to the higher order brain functions that then can process it. And guess what? your experience is going to change. Okay. Now there's other places too that this happens that we may have experienced or not. And these are also other areas that I recommend people getting in touch with. One is the periaqueductal gray area, periaqueductal gray. This is an area in the brainstem. So even prior to getting to the thalamus, there's actually an area in the brainstem. And it's well known that this area has what we call descending pain modulation pathways, right? So everything, when we talk about ascending pathways, when we talk about ascending pathways is going up. Going up is essentially, going from the periphery to the center and up. So it's going from the hands and feet to the spinal cord and up to the brain. Well, descending is going down. It's sending a signal down. And this is an area in the brain stem, so prior to getting to the thalamus, that has descending pathways that go and try to they already are modulating the signal that's coming from the ascending pathways. So there's a sort of a two-way highway, even in the spinal cord, that there's descending modulation pathways and ascending pathways. And the descending pathways from the periaqueductal gray can start to modulate the pain response going up. Right? When have people experienced possible descending pain modulation? When have people experienced? You may have experienced this. Childbirth, for instance, a cognitive conscious decision to not feel pain, but might not have been cognitive. It probably was likely precognitive by the amount of maybe hormones that were flowing through your body that actually activated the periaqueductal gray descending pain modulation pathways. People may have felt this. Athletes who perform intense physical activity, for instance, running a marathon, football players, if they get injured and they don't recognize that they're injured and they keep playing. This happens in people like long distance runners or something like that, where they might injure themselves halfway through the race and keep going. And then the next day they realize their foot swells or their ankle swells, and they go get an x-ray and they have a fractured ankle. And they go, how in the world could I have finished running with a fractured ankle? And that's exactly that. Is maybe there was an injury and you kept running on it, but you didn't feel the pain because there was so much adrenaline stress going on that your periaqueductal gray was activated and you had descending pain modulation that was actually decreasing the firing. So we do have these endogenous mechanisms in the body that are modulating our pain and the sensory input that comes in to the cortex that then processes it all and puts it all together, and it's all interconnected and then spits out this experience. Right. So when I tell you, thalamic modulation therapy, TMT, not TNT, but TMT, that's exactly what it is. That's exactly what it is we're actually learning how to modulate the thalamus to send signals to the higher brain areas that then can process the experience, process the information. Right? And then and through that practice, we know that this can decrease the sending of noxious stimuli. So you're sort of creating a filter in the thalamus. By doing the practice, you're going to the beach and you're getting a different, sieve to filter the sand. You're like, you know what? I'm only going to allow the really, really fine, soft pieces in. The hard, really sharp ones, I don't need those against my back. I only want the super soft white sand, right? And so you bring your little filter to the beach and you filter the soft sand, and then you make a nice little bed for you, and you get rid of all the sharp shells, and maybe you give them to your brother or sister or something like that. Just kidding. That's kind of what you're doing. You're saying, with this practice, I'm decreasing the noxious stimuli that's actually able to get through. So it's nothing but thalamic modulation, as well as other areas, but we're modulating the thalamus, which, if you look at that, if you look at the function of the thalamus and you see that that's one of the first findings of what it does in terms of the number of other things that it does, and then if we're modulating the thalamus, it's more likely than not that we're also then probably affecting the fluid in the cerebrospinal fluid. And then we're activating our breath. So now we're changing the rhythm of the fluid in the third ventricle as we are breathing. And now you have a whole, it's a sort of like you're like orchestrating this dynamic interplay of fluids and structures and, neuronal connections that are lessened or being made or whatever it might be. And then you're having a conscious input on your experience of what it is that you're sending through. I hope that makes sense. We've belabored on it, but it's so important. I can't stress this enough. It's so important to have this understanding, because it's sort of like, if you have this understanding, you might be like, I am going to go practice now. I am going to go practice, knowing that you are modulating. I tend to go to different realms, right? But if it's just the realm of what we know from research, right? We know that, for instance, the breath modulates the cerebrospinal fluid and it can make it rhythmic. We know that different types of breathing, for instance, like belly breathing or diaphragmatic breathing, can do it more than others. We know that taking inspirations can bring the fluid up into the third ventricle. We know that the practice of mindfulness can affect the thalamus. And actually, we see that in the studies, and now it's been replicated numerous times, that this practice actually shifts the way that the thalamus is functioning, and all that anatomically, physiologically, we know that that's what it does. And now we can then there's the next hypotheses, right? There's the next, wow, could that be? And when you tap into your own experience authentically, where do you sense it? What do you sense? Some people have a greater interoceptive capacity than others and can sense it. Others are starting to learn it. And now it's being authentic and saying, what do I sense? And where is that? And and if I know the anatomy or the physiology of what's happening in those areas, what smart, intelligent deductions can we make based on what we know how the body works, but also what we know how energy works or light works or electricity works, right? And just think of, we are 2,000 years away from where we're going to be in the year 4,000. And where were we in the year 0 in terms of understanding what the human body did or can do, or the anatomy of it? So those are the questions to be asked, and that's exactly the hypothesis. And then it's really about people's experiences, authenticating people's experiences. Okay. All right. Let's go into our practice. Okay, let's find a comfortable posture. A posture you feel relaxed yet alert. Closing your eyes if you feel comfortable closing your eyes.
If not, having a soft downward gaze. As you're gazing off on the horizon, a setting sun over the ocean, the rising full moon. And just taking 2 or 3 deep breaths. And with each exhale, releasing any tension or stress you may feel in your body, or even if it's just the intention of allowing your body to be here now. And then breathing regularly at whatever pace works best for you. And bringing your attention to the present moment. And simply noticing what is arising for you in this moment. What do you notice in terms of thoughts, perceptions, emotions, or sensations? Can you simply be aware of them without giving too much attention to any one of them? You may notice your attention jumping from thing to thing, and that's perfectly fine, simply noticing that. And for this practice, bringing your attention to your breath, the sensation of the breath in the body, where you feel it the most. It may be across your upper lip, as the air flows into your nostrils. It may be the movement of the air through your nostrils, the expansion and contraction of your chest or your belly. It may be your whole body. But for this practice, that will be our anchor, our resource. And we simply come back to this, paying attention to the sensation of the breath over and over and over again with each breath. And as your mind wanders, simply bringing it back to your anchor or resource, being your breath, the sensations of your breath, as you feel them, sense them, moment to moment, moment to moment. And knowing that as you are doing this practice, you are actively modulating your thalamus. The major sensory relay hub in your brain. That this practice is modulating the thalamus, is filtering those noxious stimuli, trying to get to your brain. All while the thalamus is being bathed by the cerebrospinal fluid, with the third ventricle in the middle, and the lateral ventricles right on top of it. As we breathe in, more cerebrospinal fluid comes into our brain, into our third ventricle, massaging the thalamus from the inside. Balancing the right and left spheres of the thalamus. All while we're breathing, paying attention to the sensations of the breath in the body. Actively modulating your thalamus with this practice. And from your breath to your thalamus, to your brain, to the fluid within the brain, outside the brain, to all the fluid in your body, connecting with your whole body. Allowing your whole body to breathe. Expanding to just outside your body, to the universe and beyond. Expanding your perception through your body to everything, to all of existence. In all moments, in all dimensions. As we perceive ourselves breathing in this body. And now taking 2 or 3 deep breaths, feeling your body breathing, your chest expanding, your belly expanding, rubbing your hands together, feeling your feet on the floor or whatever surface they're on, your thighs on the chair, opening your eyes if your eyes were closed, reorienting yourself to your room, your surroundings. Stretching or moving if you need to stretch. And sending yourself a little bit of love and gratitude today for doing this practice. And just reflecting on the practice.